Right, so our big focus tonight, as Rishika mentioned, that we are looking at Maharashtra government's dramatic decision to virtually, quote unquote, take over all the private hospitals in the state in light of the virus surging and a concern that they don't have enough beds. And also, they claim allegations that private hospitals are simply overcharging patients in this time of a pandemic. So these are the big picture points coming out of the Maharashtra government's notification, where they've essentially invoked the Epidemic Act to say that they have taken over or are going to regulate 80% of all private beds in Maharashtra's hospitals. So for 80% of these beds, it's the Maharashtra government that is actually going to be determining the price. Price has been capped. For the remaining 20%, the private hospitals can choose to price it as they wish. But they've also said that the quality of care has to be the same across all these different categories, whether it's capped or not capped. The quality of care has to be provided the same by the hospitals. And this doesn't just pertain to COVID. This is all medical services. So in fact, they've capped prices for close to 270 medical procedures, everything ranging from cancer care to cardiac care to gynecology, you name it. It's all been capped in a detailed list by the Maharashtra government. Now, specifically, if one looks at what they've done as far as COVID is concerned, Rishika, these are the numbers which we'll put up on the screen for you. So for COVID care, this is how they've capped it. So they've said that for general ward COVID beds, the price has been capped at 4,000 rupees a bed. This is all per night or per day rates. For ICU beds, COVID ICU beds, it's been capped at 7,500 rupees per night per bed. And for ICU with ventilator beds, they've capped it at 9,000 rupees per day. But Rishika, of course, the comparisons to what the actual rates are in private hospitals is starkly different.
Well, absolutely. And let me just, since we're talking about non-COVID here as well, Vasu, what we're putting out on our screens right now is a graphic that explains what the cap price for non-COVID procedures and surgeries is. So an angioplasty is capped at 1.2 lakh rupees. An appendix procedure is capped at 92,559. C-section at 86,000. A cataract operation, which is usually very expensive, 25,000. A knee replacement at 1.6 lakhs. Dialysis at 2,500 and a mastectomy at 1.43 lakhs. Let's also, just draw out a comparison of what it looks like when you see what a routine bed, cost otherwise and what it's costing now. So a routine ward, which is around 10,000 rupees, is now somewhere close to 4,000. An ICU bed, which is 50,000 plus, is capped at 7,500, and ICU beds with ventilators that usually would run up a bill of 60,000 rupees per patient per day with medical costs, tests, etc. included, is now capped at 9,000. Vasu?
Right. Okay. Joining us tonight on the debate with us, we have Priyanka Chopra, Rajya Sabha MP of the Shiv Sena, senior leader and spokesperson of that party. We have Dr. Sanjay Nagral, Surgeon Jaslok Hospital, with us. We have Anil Vinayak, who's Group CEO of the Fortis Healthcare Group. They have, hospitals all over the country, including in Bombay. And also Dr. Mohan Joshi, who's Dean of Nayar Hospital, which is one of the biggest government hospitals in Mumbai, which is handling COVID care. It's exclusively a COVID care hospital. Let me just start with you, Anil Vinayak, about this Maharashtra government's somewhat dramatic decision to now regulate 80% of private hospital beds. Is it realistic?
Well, in view of the shortage that they were experiencing of hospital beds in Mumbai, specifically in the public sector, the decision has been made, and I think it's the right thing for the state. At this point of where we are, we need to be supportive. Obviously, there will be massive impacts on the sector, but I think this is a time when all of us have to step up and play out our responsibilities. There is, of course, 20% which will continue to be at rates that are not governed. And the only unfortunate thing is that there is no laddering either, which means that across categories of beds, the same price will apply. So there may be some logistical challenges in how you deal with that. But on our behalf, I would say that Fortis is already very supportive of all the efforts in Maharashtra We have 4 hospitals that are already dedicating 200 beds to COVID, and we already have about 170 patients being treated right now as we speak. So we support the government in this time of need.
Give me a sense. Give me a sense of when you say that this is you're accepting this in the spirit in which it's been done. But give me a sense of the price comparison here. So the cap for the COVID beds is 4,000 rupees, general ward 7,500, ICU non-ventilator 9,000, ICU with ventilator. What is the comparative price that you are charging for these categories right now in your hospitals? How much does an ICU bed cost?
So firstly, it varies by hospital, and we have 4 different hospitals in Mumbai, one quaternary care and other hospitals as well.
Sure.
Also, it's a little early to be able to give you those comparisons. Suffice it to say that there's a substantial impact. There is a substantial impact. Substantial
difference?
Yes.
Like 3-4 times? Can you put a number to it?
No, so when we last looked at the numbers, the average cost of treatment of a COVID patient, and I am talking about across ICU, ward, all of that, was somewhere in the fully loaded about 20 to 22,000 rupees in our hospitals in Mumbai. So that's the per day that we were experiencing. It is to be seen what the final billing will be as per the government prescribed rates now. But like I said, we will support the endeavor fully.
Okay, Rishika.
Well, absolutely. And if I could just bring in Priyanka Chaturvedi here, Rajya Sabha MP leader Shiv Sena. Priyanka, it's some may say it's a bit of an extreme move. It would even unnerve a few people that, is the crisis actually a lot more than what meets the eye? We're looking at 40,000 plus cases in Maharashtra, but 80% capacity of private hospitals being taken over for a period of 3 months.
I don't know if it's my internet connection or if it is a problem at your end in terms of connectivity, but I did get your first part of your question with regards of it being an extreme step. We must understand we are living in extreme circumstances at this point in time, facing the pandemic, which has no solution except for social distancing and staying at homes and ensuring self-hygiene, personal hygiene. And hospitals which are overwhelmed, our government facilities which are overwhelmed at this point in time in terms of being able to provide good care to all the patients who have been coming in. Let me give you a picture of where we stand today. Maharashtra's bed occupancy, especially Mumbai, considering Mumbai has seen the major brunt of it, is at this point in time 77%. However, we need to augment our infrastructure, and for that we have also taken into consideration bringing in these hospitals, private hospitals, and their participation. Earlier we were hoping that we could work together in terms of pricing, in terms of ensuring good healthcare is given, because like I said, extreme circumstances also make us take decisions which need to make a city and a state.
No, I think the question is that obviously for something of this scale, you do need to have private public together, but the tone and tenor of this notification seem to suggest that you are basically alleging, more or less, that private hospitals are vastly overcharging. And that's why you've had to cap prices at almost 3 to 4 times the market rate.
Here's the thing, like I said, in extreme circumstances, few years down the line, history will judge us as to whether we were profiteering out of this pandemic or whether we were cooperating as citizens, as humanitarians in this time of crisis. So considering that there were many issues that had come in, there were many requests, many bills that were floating around social media also, where there were cases of overcharging, cases of COVID patients being turned away, cases of other, besides COVID-related cases, other cases also were not being catered to. For whatever reasons, there were many cases where private hospitals were not opening up, nursing homes were not opening up. So as a state government, we wish to not intervene. But however, when we see the crisis needs cooperation from all, we will feel free to intervene in such cases. And this crisis at this point in time calls for that. All hands on deck is what the government has been saying.
Fair enough. Rishika.
Right. But, just because you're saying that this is an extreme situation, Vasu, you were actually there in Mumbai not very long ago. You've been to several of these hospitals, inside ICUs as well.
Yes.
What's it been like? Because we know that the space between beds was reduced in hospitals in order to make room for more. So the situation is obviously very grim in Maharashtra.
It is very grim, and as Priyanka said, at 70% occupancy. Some of the data we got last week suggested they were at 100% occupancy. So like virtually every hospital bed, COVID hospital bed, private, public, ICU, non-ICU seem to be taken.
Right.
And there are actually waiting queues for people to actually get admitted. But the question I want to ask Dr. Nagral is that, Dr. Nagral, Anil Vinayak was somewhat sanguine about this decision. He says they'll take it in the right spirit. A number of private hospital owners and administrators we spoke to said, we are deeply concerned and we are simply not going to be able to sustain providing quality care at these prices. We're already hugely stretched because there's a huge top up when you try to provide COVID service. You arrange housing for staff and so on and so forth. One person actually said, this is going to finish the private healthcare sector. Dr. Nagral.
Yeah, so I was saying that the reason why we find all this extreme and dramatic is because we have had a private sector for long, which was not regulated. No country in the world allows the private sector to charge as per their whims and fancies. It is always controlled and regulated. So that's one thing we must understand. And of course, in a pandemic, there's absolutely question. And by the way, there is a basis for this. And the basis we must understand is, number one, a large number of doctors in the private sector are trained in the public sector by public money. So we must understand this. The second, of course, a large number of hospitals are charitable hospitals, which get indirect benefits from government. So it is a give back. It is not a favor. It's a give back. And there are many doctors in the private sector who want to participate in this. And I think therefore it's a very important move.
Okay, so you also support this, but
yes.
Okay, but Dr. Mohan Joshi, Dean Nair Hospital, we had actually come to your hospital and we had a chance to look at what it's like inside. We can try to even play that video of what it's like inside a Nair Hospital general COVID ward, absolutely full to capacity, beds already close to each other. So, I mean, when you talk about reducing space, there's virtually no scope for that. Is this going to help, Dr. Joshi, to have now private hospitals also providing beds at these cheaper rates? Is it realistic? And are private hospitals, I mean, are they overcharging, basically? That seems to be the point here.
Whether they are overcharging or not is a question of debate. Let's not talk about that. But what we need to tell is that we need more number of beds. There is a limit to which the free hospitals can help out in raising the number of beds. Every patient should get a comfortable bed, should get a comfortable treatment. And therefore now there is no option but to take over the private hospitals. They are 80% bed, not at a free cost, but at a cost which is reasonable, at a cost where they are probably forced to reduce their profit margins. They are probably forced to have less sort of luxury.
Right.
And that is going to help the patients.
What is your situation right now?
Yeah. I have got today 824 beds commissioned and almost 812 beds are full today. This is the scenario of Nair Hospital. And this is probably the second largest center in the state of Maharashtra, which is fully COVID. So we need more number of beds.
Right.
Okay.
But the other big question that I want to ask here, Vasu, if I could just jump in, is that this has been done for a period of 3 months. And if I could just ask a very quick follow-up question, to Dr. Nair, to Dr. Joshi, I beg your pardon, of the Nair Hospital. Dr. Joshi, do you think it's enough? This for a period of 3 months. Do you believe that we'd have tackled the problem? We'd be flattening the curve by then?
I think so. By the end of June, large amount of work will go down, and July and August maybe that will be, through the pandemic or will be, having a very diminished work. And maybe that everybody will be used to it as to treat patients who are COVID positive and COVID negative as well in an institution and treat everybody at par.
Okay, but the point is, coming back to Anil Vinayak, Mr. Vinayak, that if you hear what the tone and tenor has been, it has been that private hospitals have been overcharging. And that's really why this step had to be taken. Do you accept that?
Srinivasan, I think, everybody gets tarred with the same brush. And sometimes, we benefit from that, and sometimes this is a disadvantage. I can, on behalf of Fortis, say that, we have delivered on our duty to the state of Maharashtra. We are today we've treated right through, we've not turned away any patients. And our billing has been extremely reasonable. We have been very responsible when it comes to how much is the markup on PPE, what are we using, what are the quantities being billed. All of that we have been very, very cognizant of and very, very careful about. We do believe that at this point in time, it is our responsibility to deliver good care. And we've done our best.
Asking you how much you're charging. You're not willing to share with us.
Sorry, Srinivasan, I missed that.
I'm saying you're not willing to tell us how much you're charging for a room, so it's hard to tell whether you're overcharging or not.
So I just told you that the average cost to a COVID patient in our hospital over the last 2.5 months that we've been servicing patients is about 25 to 26,000 rupees, and that includes all the critical care patients that we have managed, and some of them we pulled back from life and death situations. And as a quaternary care hospital, we have handled the most difficult cases. So that's been the reality. Now, obviously, that's not the perception, and we all need to introspect as to why there is such a big gap and what can we do to address that.
Okay.
So, can I just come in, Vasu?
Yeah, I think, Rishika, should we start? I believe we're literally out of time.
Right. I think we are completely out of time. But I think what's been really interesting is how the private sector has welcomed this, at least on national television, with open arms. It is for a period of 3 months.
Rishika,
I know Priyanka also
wanted
to jump in here. I'm afraid we're completely out of time. But this is definitely,
point,
just on the bright side, Vasu, definitely going to, make good quality healthcare accessible to many, many more people, which I think is the need of the hour. And you, of course, have seen it firsthand while you've been touring all over the country.
Well, just bear in mind that only one private player on this show has welcomed it. We don't know if that's true across the board, but we'll keep a track on this big story. I know many of you want to still come in, but we'll come back to the story for sure. Thank you so much for joining us tonight on this special broadcast. Thanks very much.